The NHS can be saved. Keir Starmer's response to a damning report into the health service.
The NHS may be in a critical condition, but its vital signs are strong. And we need to have the courage to deliver long-term reform. Major surgery, not sticking plasters.
But on the same day, new data revealed this summer was the busiest ever for A&Es in England. The Prime Minister refused to be drawn on when patients would see improvements.
If you were to speak to one single patient who's been suffering in agony for so long, what would you say to him or her about how you're going to fix the NHS and make them better in the short term?
I accept the challenge to me, which is it's going to take a long time. It's going to be measured in years, not months. And we need to have something to say for someone who's ill now, which is getting the NHS back on its feet. But we can't duck the long-term change. Through the central,
The Prime Minister's speech followed the publication of an investigation by Lord Darzi, which found waiting lists and waiting times are surging, with A&E queues more than doubling in the past 15 years. Too much of the NHS budget being spent in hospitals and too little in communities. And the UK has higher cancer mortality rates than comparable countries. Many of the problems identified by Lord Darzi in his report are already well known, but now they've been laid bare in a government report.